Good morning, good night, good afternoon, all of you. I'm Dr. Che, and today we will discuss some important reading tips. Okay, just let me share. If you can hear me, just let me know, please. Because today we will discuss important reading tips. If anybody can hear me, just let me know, please. Okay, so so if you can hear me, just let me know. Just let me share the session with other doctors and nurses. Then we will continue. Okay. Just 1 minute, please. So yesterday we have discussed reading part A, question number 1 to question number 7. So today we will discuss again reading tips. We will do question numbers 8 till end. Okay, whatever we can do. Okay, just let me finish sharing with your colleagues. If you can share the session with other doctor nurses, that would be great. So at any time, if you have any question, you can ask me. Okay, thank you so much, all of you. I can see Glorinda, Bisuzu, Dr. Suzu, Saika Khan, Asma Star, Munib Khan, okay, Shabashir Ali, Rabia. Okay, thank you so much, all of you. So now let us start, okay. So some of you are new today, some of you have joined yesterday's class, okay. Okay, can you see my screen? It is written Omeprazole here, reading part A. By the way, these are my own samples. Okay, these samples you should have not done before. Okay, because these are my own sample. This is written by myself. Okay, reading sample. So it is not like you people do gesture files and here and there. So this is new. Okay, so reading part A. So strategy. Just some people are new. Just let me just give a quick review about how to do reading part A. So in reading part A, the main thing is time management. Okay, time management. Just quickly, I'm going to discuss. So time management. You will be having 15 minutes and you will have 20 questions to solve in 15 minutes. So it is not easy. The main thing here is the time management. If you cannot solve your 20 questions in 15 minutes, then it is very difficult for you to get B grade and get 20 out of 20 or 19 out of 20 in reading part A. If you miss some questions in reading part A, then reading part B and C is already difficult, then your chances of passing the exam, reading exam is very, chances are very low. Okay, so you need to be careful. Try to do as many questions as you can in reading part A. So in reading module, which is the difficult, one of the most difficult modules in OET. So reading is one of the most difficult module. Okay. For example, in IELTS, if you people remember, writing was most difficult for us. For many of us, writing was the most difficult module in IELTS, and in OET, reading is the most difficult. Reading is the most difficult modules. You people need to be careful. Whenever you do any sample, any reading sample, okay, so you need to do critical analysis of your mistakes. Critical analysis, okay, critical analysis of your mistakes. If you people can share the session in any, relevant group of doctors, nurses, it would be great. Whenever you do any sample, after you make mistakes, okay, you will make mistakes, of course you will make mistakes. So then do critical analysis of your mistakes. Okay, why I got this wrong? Okay, why, what is the correct option, why mine is wrong? So this is how to find the question, how to find the answer. Okay, so all of these things you need to do critical analysis. If you don't do, if you keep doing a lot of samples, believe me, at the end there would be no any big improvement. Okay, the thing is, you should know how to find the answers, and if you can get a grip on what the examiner is looking for and what are the tricks they are using. If you can find these things, what are the tricks that examiner is using, what are the tricks that examiner is using, how he or she is making the questions, and okay, to check your knowledge. And if you can do right approach, believe me, you will be able to do a lot of questions. Okay, so now why my main focus is reading part A. We will also do reading part B also, the main focus, because reading part A is the key to success. Key to success. If you get 20 out of 20, you only need 10 out of 22 in reading part B and C. It means your key to success is reading part A. If you can get 20 out of 20, if you can get 19 out of 20 reading part A, you can easily pass your exam. Believe me. Okay. Why people fail? Because they get 14 out of 20, 15 out of 20 reading part A. B and C is already difficult, then they struggle to get B grade. Okay, so this is the important thing. Okay, now let us just discuss reading part A. Okay, how to approach reading part A, how to finish it quickly. Okay, so first thing that I have mentioned yesterday, that first we need to do scheming and scanning. Okay, scheming and scanning. For example, this is a sample. Okay, this is my own sample written by me. Okay, a few months ago, then I was on break. Okay, so this is text A, this is omeprazole, text A, B, C, and D. You will be having 4 texts. So first of all, before reading questions, before reading what is within the text, you need to get an overview of the text. Okay, so for example, this is called scheming and scanning. Okay, scheming and scanning. If we do scheming and scanning of this text, that is omeprazole, what do you think it is in text A? What do you think is in text A? Omeprazole, as all of you know, as antacid. Okay, antacid, PPI. So what will mostly in part A is the introduction. Okay. So how the acid is produced. Okay. Then you see this first sentence is very important. Acid is produced naturally in the stomach, digest food to kill bacteria. Okay. Then at the end you can see this is referred to as acid reflux. So they are overall they are saying that what is acid reflux, what is heartburn, what is acid reflux. Okay. Then they're talking about proton pump inhibitors, mean like omeprazole, stop cells of lining of the stomach. So how they work, okay, how these PPIs work, okay. And then they are talking about omeprazole prescription here and there where you can buy and these things. This is just quick skimming and scanning. How much time we should spend on skimming and scanning? How how much time we should spend on skimming and scanning? How much time? Yes, very good, Dr. Suzu. Thank you. So you mean, yeah, this is overview of omeprazole. What is the heartburn here in this paragraph and how PPIs are omeprazole and these type of medications, okay, how they work. So we need to spend in on skimming and scanning 1 to 2 minutes. 1 to 2 minutes on skimming and scanning is very, very important. Why it is important? If you don't spend time on skimming and scanning, then when you will start reading questions, you will spend a lot of time to find the answers. That is why skimming and scanning is very, very important. So in our text, if there is any question how the heartburn or acid reflux is produced, how these medication act, what is their mechanism of action, then where we can get prescription, these things. If there is any question like that, we will go to text A. Now let us go to text B. Algorithm for diagnosis and treatment of refractory GERD. Okay, just one thing that we have discussed yesterday. Can anybody tell me synonym for refractory? Any synonym for refractory GERD? Refractory. Any synonym for refractory? Can you write in the chat? Any synonym for refractory? So if you see algorithm for diagnosis and treatment of refractory GERD, okay, recurrent, very good, recurrent, resisted, very good. This is good. Not responding to normal treatment, very good. Okay, unmanageable, very good. Okay, resistant, very good. So all of these things are the synonyms. What I will do is I will not write this resistant refractory GERD. So if you remember this question yesterday, this question, steps to follow when reflux symptoms don't respond to conventional treatment. There is no exact word conventional treatment, responding to conventional treatment or not. Okay. So now I am using synonym in paraphrasing, similar word, not responding to conventional treatment. So this is just like refractory GERD. Okay. So what we need to, which steps we need to follow? These steps. Okay. These are the steps. Okay. So here are steps. PPI for once daily for 2 months. Then we need to give we time and compliance. Then for twice daily for 2 months. If still fails, then we need to do these tests. Then empirical therapy. If negative, okay, what to do here? If empirical therapy, if still there is heartburn, what to do? If there is regurgitation, then what to do? Okay. So here is if alarm symptoms, if patient is having these alarm symptoms, upper endoscopy and treat mucosal finding. Okay. This is just quick overview of text B. In text C, we are just cautions, mean what to do. For example, when there is diarrhea, what to do. If there is liver disease, what to do. Lupus erythematosus, gastric carcinoid tumors. Then we have efficacy of clopidogrel, mean drug interaction, nephritis, prolonged use, and effect on calcium and these things. Can you hear me? Anybody? Can you hear me? Can you hear me? Okay, so sorry, I got, a little bit busy. So let us start again. So let us start again. Okay, so we were doing skimming and scanning. In part, in discussions, we have just, what to do if there is diarrhea and, here is the liver disease, skin disease, so different things. In text D, we have two parts, okay? Long-term use and pregnancy and breastfeeding, okay? So we have two things, long-term use and pregnancy and breastfeeding, okay? Okay, so in pregnancy and breastfeeding, so they are talking about what to do, how to use omeprazole in pregnancy and breastfeeding. Now let us go to questions. Okay, question number 8. Okay, so let me see again if you people can hear me. So if you read the question number 8, okay, question number 8. What we should do if you are unable to perform a specific test and there is partial relief of symptoms after taking PPIs every 12 hours? In which text we should find this answer to this question? In which text? What we should do if you are unable to perform a specific test and there is partial relief of symptoms after taking PPIs every 12 hours? In which text you can find the answer? Please quickly. Answer quickly, please. In which text? In which text? Okay, text B. So here the answer is we need to fill in the blank here. We need to fill in the blank, okay? What we should do if you're unable to perform a specific test and there is partial relief of symptoms after taking PPIs every 12 hours, okay? Let me copy question and let us go to the text B, okay? Okay. Again, I'm going to copy the question here so that you people, what we should do if you're unable to perform a specific test and there is partial relief of symptoms after taking PPIs every 12 hours. Try to find the answer here, please. What is the answer? This is the text, but what is the exact answer? This is the text. What is the exact answer? What is the exact answer? What is the answer? Switch to another PPI. Very good. Empirical therapy. Very good. Very good, Dr. Nadeem. Esophageal impedance and PPH. Switch to another. Very good. Very good. Switch to another PPI. Very good. Switch. Where is it written? Switch to another PPI. Where it is written? Doctors and nurses, please focus. Focus on the question. Focus on the question. Focus on the question, please. Left corner, right or left corner, no. So most of you are wrong. Just one people have answered correct answer. Okay. So now let us focus on the question. Some people are saying this one, switch to another PPI. Why it is wrong? Why it is wrong? PPI once daily, 2 months. Okay, review. If there is fail, then switch to another PPI for 2 months. Then PPI twice daily. Then if there is fail, and then we will go next. Okay. So what we should do if we are unable to perform a specific test and there is a partial leave of symptoms after taking PPI every 12 hours. Where we are taking PPI every 12 hours, here we are taking PPI every 24 hours. Here we are taking PPI every BD every 12 hours. That is why I have changed the question. So here after taking PPI twice daily, okay, still there are symptoms and these are the tests esophageal impedance and PPH and pH, okay, and pH. If we cannot perform these tests, no access to esophageal impedance, we cannot perform this specific test or specific procedure. So then what we should do? We should give empirical therapy. What is the answer? What is the answer? Empirical therapy. What we should do if we are unable to perform a specific test and there is partial relief of symptoms after taking PPI every 12 hours, means after taking PPI twice daily, BD twice daily. So now what is the answer? So how many of you got the answer wrong? AM and PM empirical therapy. Very good. Dr. Yusuf Zai Khan. Very good. Okay, so you people can see Miss Saika got this correct. Then Somia and Dr. Nadeem, Miss Sadaf, Dr. Ireni, Miss Ireni, Dr. Suzu, and sorry for your names. And so most of you got this wrong. Most of you got this wrong. Yes, Miss Saika Khan is correct. Dr. Saika Khan, I don't know. You people see what is the strategy. You people need to focus on what is the strategy, what the examiner is looking for. So now I am telling that after taking PPI 12 hours, 12 hours mean BD twice daily. After taking it, if still there are symptoms, we have two options. Go for this or go for this. Empirical therapy or esophageal impedance plus pH. We will do empirical therapy if there is no access to esophageal impedance. So I have told you that if we are unable to perform a specific test, specific procedure, then we have taken PPI twice daily and still there are symptoms, there is failure, and we cannot do a specific test, impedance, esophageal impedance, then we will go for empirical therapy. Doctors and nurses, this is how the examiner will test your knowledge. Okay, they will test your ability to do reading test. Okay, otherwise everybody can answer direct questions. Okay, now let us go to next question. Okay, if we are aiming to relieve heartburn for a short period of time, omeprazole can be found at a dash. Okay, in which text we can find the answer? Okay, so if you are aiming to relieve heartburn for a short period of time, omeprazole can be found at a dash. In which text we can find the answer? In which text? Quickly, please, quickly. You need to learn something. Here I cannot, you know, you may feel boring, but my main aim is that when you leave the class, you should have learned something. Okay. Don't come here and go without learning anything. So we are maybe a little bit slow, but the main thing is you people need to learn. Okay. Okay. So now let's go to text A. You people will find the answer and you will write what is the answer. What is the answer? Just let me show you the question again. If we are aiming to relieve heartburn for a short period of time, omeprazole can be found at a dash. This is the question. Now you people find the answer and tell me what is the answer. Okay. What is the answer, please? What is the answer? Very good. Very good. Okay. Very good. Okay. So the keywords you people can see here. The keyword is aim to relieve symptoms for a short period of time. Relieve of symptoms for a short period of time. And omeprazole can be found at A. This article A is very important. A something A. Okay. So short relief for short period of time is available on prescription. You can also buy short courses of omeprazole at a pharmacy for the treatment of reflux symptoms such as heartburn in adults. So here is the answer. Very good. Okay, excellent. Excellent. All of you excellent. Okay. Now let us move to next question. So now the next question is, to save it from negative effects of acid produced by stomach, omeprazole should be given to the patient in. Omeprazole should be given to the patient in. You people know from your knowledge, but we need to find in which text. In which text? To save it from negative effects of acid produced by stomach, omeprazole should be given to the patient in. In which text? C. Okay, let us go to C. In questions. Here are the questions. Please let me know what is the answer. Which bullet point? This is 1, 2, 3. Okay, which bullet point? Doctor, Miss Shamo, don't use your knowledge, please. Don't use your knowledge. Just find in the text, because maybe in your knowledge this is other answer, but in the text it should be. Okay, so this is a very important thing in OET. You should never use your background knowledge to find the answer in reading. please find in the text. So what is the answer? The answer. What is the answer, please? Quickly. Let me copy the question so people, you can see the question also here. So this is text B, C, and here is your question. Okay, this is your question and this is your text. Please try to find the answer quickly, please. Not in C. Very good. Very good. This is how you will waste your time. You will go to C. You will try to find there would be no answer. Then we will go to other text. Okay. So there is no answer there. There is no answer. No, not here. Not here, not here. No, no, there is no answer. There is no answer. At A, okay, let us go to A. No problem, no problem. Let us go to A. Let us go to A. Okay, where is the answer? Okay, where is the answer, please? What is the answer in A? 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 Okay. What is the answer? No? Okay. Let us move to other place. In algorithm, no. Dr. Nadeem is saying at the end of algorithm. No, at the end of algorithm, no. In algorithm, no. No. So we have only one part left in text D. Okay, try to find here, please. Try to find here, please. You people can see how much time you have spent in finding which text you can find the answer to this question. So this is how you will spend time. No, it is not in B, it is in D. Please try to find the answer. It is in D. Try to find the answer, please. Try to find the answer, please. Very good. Dr. Irene Hagan. Okay, very good. So we should use interrogated formulation. Administration in interrogated formulation due to its rapid degradation in the acid conditions of the stomach. Okay. So the answer is interrogated formulation. Now believe me, this was a very easy question, very easy. But what was the trick in this question? What was the trick? What was the trick? The trick was you will not be able to find the text quickly in which you can find the answer. You will go to C, then you will go to B, then you will come back to D. Okay, in meanwhile, you must have spent more than 1 minute. This is how the time management works. Okay, so time management is very, very important. Okay, so when you do skimming and scanning, try to have a look at the important things. Okay, this was the question. To save it from negative effects of acid produced by stomach, omeprazole should be given to the patient in enteric coated formulation. Enteric coated formulation. Okay, now let us move to next. Deficiency of dash can cause fits in patient due to long-term use of omeprazole. In which text? Yes, of course. Acid condition is keyword. Very good, Dr. Yusuf Zai. Very good. Deficiency of dash can cause fits in patients due to long-term use of omeprazole. In which text? In which text? D. Okay. What are the keywords? What are the keywords here? Keywords here. Number one, deficiency of something. Number two, fits. And number three is long-term use. So there are three keywords. Three keywords. Deficiency of something, fits, and long-term use of omeprazole. Okay. Three keywords are here. Okay. Now try to find here. This is the long-term use. If you people remember in text D, we have long-term use. Okay. So what is the answer? What is the answer, please? Quickly. Quickly, please. Quickly. Where is the deficiency of magnesium, Dr. Sharitha? Calcium, magnesium. Very good. Magnesium, very good. Calcium, very good. Where? In which paragraph? In which paragraph? Calcium and magnesium, very good, very good. But in which paragraph? Okay, so in which paragraph? No, here no. There is no mention of any fits here. Let us see here. Doctors, there is no mention of any fits here. There is no mention of any fits. No fits here, please. No fits. This is wrong. Magnesium and calcium is wrong here. It is not written here. So deficiency cannot be deficiency of scissors. No, please. Okay, let me see here. Okay, long-term users, temporary. No here, not here. Confirmed. Here, okay. Here is the answer. So let us try to find here. Mercury deficiency in the blood can cause after prolonged use. Adverse effect result in muscle spasm, irregular heartbeat, and seizure in 25 cases reviewed. Okay, they did not improve domination. Okay, so what is the answer? What is the answer? Magnesium. Okay, no. The answer I'm looking for, what is the deficiency of what? Okay, deficiency of magnesium can cause fits in patients due to long-term use of omeprazole. Here the answer should be magnesium. You people were finding here magnesium, but it's not mentioned here any magnesium. This magnesium, it is not mentioned fits here. So this is wrong. So it is not here. The answer is here. Magnesium, fits, and this is long-term use. So all the three keywords can match here. Magnesium deficiency, long-term use, and here is the seizures. Okay, so you can find all the keywords here. Okay, thank you so much. So please give me feedback on my WhatsApp number. So tomorrow we should continue with reading or we should discuss any other module. So if you have any question, you can ask me on my WhatsApp number. So today I got a little bit busy during the class, but anyway, you people have learned. The main thing is you need to take the tricks, how to find the answer. What are the tricks? Okay, the main things. Okay, very good. And thank you so much. So see you tomorrow. Please give me feedback and invite your friends. Okay, invite your friends. Okay, invite your friends to the class also. Thank you so much.